Welcome back to N-Powerment Nursing. I'm Linda and this is Ashley and we are nurse educators. You are tuning into our series In the Know where we make it simple. Today we are chatting about revving up your study process.
We invite you to subscribe to our live videos so you'll be notified whenever we go online, which is typically a few times a week. You can also subscribe to our YouTube channel, like and share this video with all your nursing buddies, follow our Facebook page, and check out our website at www.n-powermentnursing.com, where you can experience our free trial and see all of our study packages.
So let's talk about why students don't enjoy the study process. Well, it's not very exciting, because you're reading a lot of words. It's not very creative. It leads to a lack of understanding and a lack of application of content. So how could it possibly be exciting and enjoyable if you're not having fun?
Zero fun. Let's see a show of hands. Add in the comments below this video as you're watching. Thumbs up if you think studying can be fun. Thumbs down if you think ain't no way the study process is going to be fun. And we're talking about the registration exams. We're talking about the NCLEX, the CPNRE, or the NCLEX-PN. Who out there thinks that the study process can be fun? How many thumbs up do you think we're going to get? We think the study process can be fun. In fact, we know it can be fun, and we know it can be exciting. It's about how you engage in it, how it's taught to you, the way that it's done. We hear all the time from people who complete our program, for the first time ever, I was excited about studying. I felt revved up to tune into your videos. I was so excited to come back to day 2 of the live review because for the first time ever, I was understanding things in ways I've never understood them before. I was applying concepts that I'd never been able to apply before. I was making connections that I'd never put together before. You get excited when you are having fun with the study process. And how do we do that? We're not what you're used to. Yes, we are professors of nursing in our full-time jobs, but we're not your average professors. We are creative, we draw, we're passionate, we are storytellers. We do a whole bunch of things, but it gets down to the fact that we teach you in ways that you've never ever been taught. In fun, at times very sarcastic, simple ways that will deepen your understanding and give you the ability to apply concepts in ways that you've never ever been able to do before. And we're going to tell you how we managed to do that.
Well, going back when you were in school, you learn subject by subject. You go to one class and then you go to another class and then you go to another class, and those classes aren't integrated. In school, you have to make those connections for yourself between the content that you learn from class to class, from year to year. And we do this as we teach the content, all of the content over 4 days, or if you're using our video library from the comfort of your home. In doing this, we can connect the content quickly. From the body balance section, for instance, when Ashley teaches about acid-base balance and then brings it back into the respiratory section, and then when we bring it into the GI section. So we're able to apply that concept throughout the content. And then we can help you also make those connections. And it helps you to get to the answer. And that is super validating to your understanding. And then this is fun, especially when Ashley ninja kicks with excitement.
What can I say? On day 1 of the review, we get into acid base, and that's like the most dreaded thing of the majority of students. And I tell them, I teach acid base with a party horn. And I tell them, I am going to turn you into an acid base ninja. And so when we get to day 3, or however many videos later in the video web library, and I give you a situation, these are the symptoms of your patient, tell me what their acid-base imbalance is, tell me what you're going to do about it, and everybody in the room knows the answer, I got to do a ninja kick, right? Literally, I'm so excited, and they get so excited because they are acid-base ninjas. Like, they know instantly, without a doubt, the answer to that question. And that moment is just so incredibly validating for us. So not only do I use a party horn to teach acid base, to give a visual demonstration of acid either leaving the body or being retained in the body, we use a ton of props when we teach. I wanted to bring them here today, but then it would have been like a little too Mr. Dress Up and distracting, so I didn't do that. But we're going to give you some examples of the different props we bring into our program. One of them is a Barbie doll. What's great about Barbie is that her body moves the same way our body moves. So we can use this to demonstrate positioning for safety. Huge on your registration exam. What position are you going to put the patient in for safety? We can use it to demonstrate how we use our body for gravity. I use it to demonstrate post-op hip replacement and the positions you should or shouldn't put a patient in. Let me tell you, when you adduct Barbie's leg and her leg snaps off, it's a very visual demonstration of, oh yeah, that's why I wouldn't want to adduct a post-op hip replacement, because it's going to pop out. And it's also hilarious and super fun, dare I say, to pop Barbie's leg off and show you why you wouldn't do that to a patient. So we use Barbies. We use party horns. We use minions. And I can't let you in on what that inside joke is, but if you're part of our program, you're going to laugh when you hear this about how anytime we talk about the lab, we talk about the minions. You're going to know exactly what I'm talking about. We use balloons to demonstrate chest tubes, cardiac issues, other respiratory issues. We use Kool-Aid. What could Kool-Aid possibly have to do with the body? Let me tell you, concentration and dilution, I as a student, whenever that you get into concentrations, I shut down because it's too chemistry and I don't enjoy chemistry. Love the people who do. I'm not one of those people. But concentration and dilution, fluid and electrolytes, body balance is as simple as making Kool-Aid. And it's as fun as making Kool-Aid. And so this is how we use props to bring fun into your study process. Not only is it fun, it's super, super useful.
Yeah. Draw a picture. It'll last longer. We've said this before, but a picture is indeed worth 1,000 words. You draw it and you remember it. Mm-hmm. We draw pictures on almost every page of our textbook. And this is so helpful because they work and they're fun.
Especially when you're as bad at drawing pictures as Linda and I are, because it's hilarious. Like, if you wait till you see Linda's shockmobile, it will literally shock you. But very useful again, but also very fun. So we hope we've managed to convince you that there is a way to add fun to your study process. We know there is, because we complete this work, but you got to take our word for it. There is fun to be had there. And when you replace your fear around this super stressful exam with a little bit of fun, you manage to transform your efforts, even when it is one of the most stressful exams you're ever going to write in your lifetime.
If you're looking to gain all the content, critical thinking and confidence and fun, you need to pass your NCLEX CPNRE exam. We have a complete NCLEX, NCLEX-PN, and CPNRE course packages. We guarantee you will pass or your money back. Thank you so much for joining us. We'll see you next time on In the Know.
I just want to add there that we also guarantee it'll be fun. Bye for now.
Bye for now.